around their body, right? ABC. So if I see a patient and they're walking and talking to me, I already know they're responsive. But what if you come across somebody and they look like this, right? And they're lying on the ground and their eyes aren't open. And so I'll walk up and I'll say, hey, are you okay? Can you hear me? And what if they don't respond to me, right? What if they don't say anything? The next thing I want to do is I want to shake the person gently to see if they respond. And then I can go and I can put my cheek right here by their mouth, right? And so if that person's breathing, what am I going to notice?
Air.
Breathing, yeah, you'll feel it. You'll feel it on your cheek, right? If that person's breathing, you feel it on their cheek. And I'm gonna look. My face is here. I'm gonna look right here. My eyes are right here. If that person is breathing, what are my eyes gonna see? You're gonna see the chest rise and fall, right? Yeah. So, right, I'm in this gathering information phase, right? I want to make sure this person is not dying. That's always the first priority. After, is it safe? I'm checking responsiveness, and then I'm seeing if they're breathing, if they're responding, and then if you know how, you can feel for a pulse, right? You can feel kind of right here in this crease. You should be able to feel a pulse. Don't use your thumb because you can sometimes pick up your own pulse if you use your thumb. Oh. So the side closest to you, and use these two fingers, put it right in there, and see if you can feel a pulse. Okay. And so, well, what happens then if we don't feel a pulse?
Yeah, that's the question.
Does anybody know what to do?
I don't feel anything.
Yeah, well, so you're gonna feel right here.
That means walking.
So right there, you're gonna feel. So you can't be talking or moving around because that will. Can you feel that?
Yeah. It's better to check others one.
Yeah. Check on each other. Yeah. Practice on each other.
What if it's too fat here?
Well, I mean, you can compress right over here. You don't carry a lot of fat right there. Right there is where you're going to feel. So you have this muscle that kind of runs down here. There's a little bit of a crease right there. You're going to feel in there. So scene safe. Check for responsiveness, right? Are you awake? Hey, are you okay? Shake the person gently. Don't go crazy. Maybe they have a neck injury, right? And then you're putting your face by their mouth, feeling for air, watching the chest rise, and then feeling for a pulse. Okay? So, brother, can you lay down on the floor here? Is that okay?
No. Yeah. Yes, no problem. Enjoy it. One on the table over there.
What's that?
The table back there.
What about it? I don't want him to lay on the table. What if he falls out? We really will have an emergency response situation. You can lay down right there, and then, so why don't you come and practice, okay? So you're coming to an area, you're walking down the road. It's like the Good Samaritan, right? You see a guy laying on the road like this. What do you do?
Brother, don't move.
You just stop here. Breathing is great. Remember, check for responsiveness first. Are you okay? Are you okay? Give him a little shake like that. If he's not responding, then we check, right? Yeah, try not to go like that. He said no. He said I'm not okay. Okay, so if the patient says no, I'm not okay, that means they're more okay than if they don't say they're not okay, right? So you get down beside them like this, and remember, you're feeling here, you're looking. Do I feel breath? No. Do I see the chest rise up and down? No. So I'm going to feel right here and see if I can feel a pulse. And I feel a pulse on him. Okay, he's got a heartbeat. It's a strong, steady heartbeat. So now I can just go into rescue breathing. I don't have to do chest compression. So practice feeling there and see if you can feel his heart, his pulse. Yeah. Can you feel it? It's okay if you can't. If you can't, just say no and we can practice more. So the rest of you come up here and practice, okay? All right, you guys can come up and practice on me.
In the front here, the black line.
Oh, another one. One by one.
Feel it? Good. Not feeling good? I'm feeling great. Thank you so much. All right, who's next? Come on and practice.
You go, brother. He is okay now.
These two fingers. Yeah. Yep.
So if you check others, you
Feel it?
Yeah.
There, and then check for responsiveness. Are you okay? A little shake, and then we're checking to see if the airway is open, if the breathing is okay, and if they have a heart rate. So a common thing we see is choking, right? Somebody's you're having dinner with somebody overcooked the pork a little bit, and so it's a little bit tough, right? Somebody's chomping on some Naga pork, and they get it stuck in their airway, right?
Yeah.
So what's the universal sign? Doesn't matter what language you speak. What's the universal sign for I'm choking? Yeah, well, oftentimes people will go like this, right? So listen, if I say I'm choking, doesn't matter what language I say I'm choking in, I'm not really choking. My airway is not obstructed, right? If my airway is truly obstructed, I won't be able to talk, right? So this was 10 years ago. I'm at, our friend of ours was getting married, and so we have a rehearsal dinner before the wedding where you kind of go through the wedding, you practice, and then you invite everybody for a dinner. So our friend had this, and they had some meat, and my wife was there with me, and I'm sitting there and I'm talking to friends, and my wife started choking on a piece of meat. So she comes up to me and she's doing this. And so I'll confess, initially, I was like, what are you doing? Right? I did not respond well initially. And then I started to see the panic in her face. She couldn't talk. She was doing this. Yeah. And I said, oh my goodness, my wife is choking. So I got behind her and I did the Heimlich maneuver. And was able to dislodge the food. And so I have 3 kids today, thankful for that quick response, right? So if someone's choking, you want to verify that they're choking. They're doing this. They can't speak. They're going to start to get this panic look on their face. So initially what you can do in that situation, can you stand up for me, brother? Is you can start to do some sharp back blows. So kind of have them bend over, and you can do just really hard. You can hit really hard because what you're trying to do is you're trying to forcefully make the air come out and eject that piece of whatever is obstructing their airway, right? And so what happens if enough time passes and the person can't get air? They're going to go unconscious, right? Yeah. So if I'm doing back blows, or the next move I can do is the Heimlich maneuver. So this is very effective. You're going to make a fist, and you're going to put it right here in about the middle of his abdomen, and you're going to grab with the other hand, and you're going to go upward and inward forcefully, as hard as I can. And what that's going to do is that's going to force the abdomen, the diaphragm, to force air out of the lungs and try to push that piece of food out. So I've got a person that's choking, and they're doing the universal sign, and I'm going to check, and then you can do back blows, or then you come behind, and it's going to be like this, forceful, trying to forcefully get that object out of their airway. And if the person goes unconscious, if the person is not breathing long enough that they lose consciousness, you try to gently get them to the ground, and then you can get over them like this. They're on the ground now, and you're kind of forcing up like that, right? You're pushing that direction, so it's in and up, trying to force the air to force that object out of their airway, so then they can breathe. So if you get it out, they're unconscious, and you get it out. So you're going to do that a few times, and then you're going to check the airway. You're going to physically look and see if you can see the object that's blocking the airway, okay? If you can see something, then you can use your finger and try to get it out. Right? If you don't see anything, I don't want you to just blindly put your finger in there and try to feel around because you could force it further down, right? So doing the blows, checking every so often to see if you can see the object, and then pull it out. And then if you get it out and the patient starts breathing again, right? If I get it out, if something changes, I'm always reassessing ABCs. Okay, I got it out, the airway's now open. Is the patient breathing? Yes or no, right? So based on the information I gather, that decides what I do next, right? So if the airway's open, now I check for breathing. Is the patient breathing? No, then I still need to do rescue breathing, okay? If the patient starts breathing, then I turn them over on their side. We call this the recovery position, right? And then try to support their head and make sure, and they continue to monitor to make sure that they're continuing to breathe, that their heart rate is continuing to circulate. One thing I forgot to say is if you come across somebody that's unresponsive, after checking for safety, the first thing you want to do is somebody else is there, tell them to go get help, right? Tell them to call an ambulance, tell them to call somebody to be able to transport for the hospital because we want to get this person to a higher level of medical care as soon as we can, right? So activating people around you. Okay, I'm going to take care of this person. I want you to go get help. I want you to call the ambulance or get somebody that can transport this patient to a hospital if there's something nearby. Okay?
Yeah, I have a question.
Yes.
Like, does this apply same to the kids or kids have different way of doing it?
It does, yeah. It applies the same to the kids, right? For infants, it's different. For babies, it's different. You hold them in your hand. You can do back blows, and then you flip them over and you can do compressions. I don't have time to go through all of that stuff today. So
some people, they just blow the breathe into the nose. Is that the right way?
So generally, if you're doing rescue breathing, and we'll go over that now. So if I come on a scene safe, the patient is unresponsive. Are you okay? Are you okay? And then I look, and I don't see anything in the airway, right? But I check, and the patient's not breathing, right? And so the next thing I'm going to do is to do rescue breaths, right? And so I will want to tilt the head back a little bit to make sure this airway is open, right? Because if we're laying, sometimes we're like that, and that closes off the airway. So you want to tilt the head back a little bit. We're going to plug the nose and put our mouth over their mouth and give a full breath, right? And while I'm doing that, I want to see if the chest is rising, right? If I feel like I'm pushing the air freely and the chest is rising, then I'm good. The rescue breathing is effective. But if it's hard to push the air into the person's mouth and I notice the chest isn't rising, what am I going to think then? Where does my mind go? Something's blocking the airway, right? So now I need to go and do the abdominal thrust to try to dislodge, because now it takes me back to A. It says A is not okay, so I have to work on that before I can work on B, right? And then you check for a heart rate, a pulse rate, and if you don't have a pulse rate, you go to the middle of the chest, hands like this, to the middle of the chest. I take my right hand generally, put it down, put the other one on top of it, and elbows straight, directly over the patient, and you're going like this.
How many times?
30 times. 30 times. And you're going for about 120 a minute, right? And so there's a song, I can't remember who wrote the song or who performed the song, but it's staying alive, staying alive. Staying alive, right? And so you're going to a depth of about 2.5 inches. So it's a lot. So when I've done CPR on lots of people, and most of the people I've done CPR on, I've ended up breaking their ribs.
Is that okay?
And that's okay if you're saving their life, right? So even when I was out of being a paramedic, I did orthopedics. And I had a guy come into my office one day, and the receptionist came back, and she's like, this guy just passed out in the waiting room. So I'm like, all right. I go out, and I check, and the guy's not breathing, and he doesn't have a pulse in my waiting room with all my patients out there. So I do CPR on the guy, and we're right beside the hospital, did rescue breathing and CPR, had somebody activate the ambulance, so the ambulance was on their way, the paramedics came and transported to the hospital, and they were able to save him. And so he came back to my office 2 months later, and he's like, I'm here to sign up for a hip replacement. I'm like, there's no way on earth. You try to die in my waiting room, I'm not going to put you in an operating room table. He's like, hey, you broke my ribs. And I'm like, well, you're here talking to me today, right? And he's like, yeah. He's like, I guess I need to thank you for that. So it was, it may happen, but if we're going to save somebody's life, it's something that we can be okay with. So no pulse is when we do chest compressions, right? Because we're trying to push on the heart and getting it to circulate the blood, the oxygenated blood throughout the body is what we're trying to do. So middle of the chest, one hand on top of the other hand, elbows straight, otherwise